My name is Lúsi Sωfrόνη. I'm going to finish this session today, and I'm going to do it in English, if you don't mind, so I won't speak too quickly. I work for Futurecare, a company who specializes in managing the healthcare of the international seafarer. I've been based in Athens now for 8 years, and I manage our Greek and our European business. Today, I'm going to give you an insight into the global maritime healthcare management and the role of telemedicine and the new tools that are available to assist maritime ship owners in putting into place more effective strategies for improving the healthcare of international seafarers. Managing healthcare in the 21st century is extremely complex. Insert the industry of international shipping, language and nationality differences, and the lack of familiarity with the medical institutions along world trade routes, and we have big challenges in managing the health of our crew. Shipping is a true global industry. Safety standards have been in place and perfected for controlling injuries for many years and are constantly being improved in terms of safety at sea. But what is happening to protect our seafarers when they are ill and away from home on duty in such a unique environment, living and working at sea? Today I will tell you about Futurecare and how our telemedical program at sea and medical concierge services portside are now global and every day are helping to save lives all over the world. Telemedicine has gone through some exciting changes. An accurate diagnosis is now possible via onboard telemedic systems. Here we have an onboard medical kit, a heart rate monitor, a glucose reader, and a telescopic tool. All these medical tools are easy to use and result in more accurate diagnosis of a crew member's illness or injury on board. Smartphones, laptops and iPads with apps can now allow doctors to diagnose vital signs and evaluate critical care situations face-to-face without the patient actually travelling to the doctor's office. These advances are increasing quality of diagnosis and care at sea to optimum levels. Futurecare is a global organisation offering medical care management, claims management and medical cost containment services, delivering managed healthcare exclusively to the maritime industry. There are currently 1.3 million seafarers active today, and this number presents a perfect fishbowl, so you can say, for us to study the effects of care and solutions that can be applied to this unique group of workers, which are made up of many nationalities. Healthcare, as it relates specifically to ensuring your crew, frequently seems like an unmanageable problem. But experience has shown that this doesn't have to be the case. Healthcare responds fairly rapidly to modern risk management techniques that use statistical and projective modelling and forecasting with proven clinical programs and best practices. We use a data-driven approach to identify current and emerging workforce health challenges. Then we develop and implement these strategies to manage those issues more effectively, efficiently, and predictably. Healthcare presents a wide array of challenges for the ship owner, the ship manager, the crew member, and the providers, and it's compounded when a company operates in different countries and ports. Each country or provider facility has its own healthcare system, laws and regulations, cultural and demographic norms such as diet or smoking. Risk managers, ship owners and ship managers now have access through Futurecare's Caring for the Crew program to a variety of new proprietary analytic tools for claims under the deductible. This forward strategy is implementing predictive modelling techniques based on crew members' health data, proven clinical programs to reduce the risk of frequent health problems and increase the likelihood of better health outcomes and more efficient care. This approach allows the organisation to compare and review its healthcare investments meaningfully from ship to ship across ranks, ports of call, and nationalities, and to improve the health of its employees while increasing the efficiency of its healthcare management. Futurecare offers medical assistance at sea 24 hours a day, 7 days a week, and 365 days a year. Our team of first responders are medical professionals who provide real-time communication whenever it is needed. Your captains and first officers also have access to our international team of doctors who speak many languages, including Greek. If a crew member requires hospitalization, Futurecare provides the ship owner or P&I club with a significant reduction in hospital and medical costs through our network of preferred provider organizations in most ports around the world. From booking doctor's appointments to managing a hospital stay, the cost of all medical treatment is pre-certified and medically documented. So, as we said, Futurecare operates a data-based approach. The first step is for us to work with the ship owner to obtain accurate individual health and medical data for their crew members. As part of Futurecare's Caring for the Crew program, you will automatically begin to have all your illness and injury claims tracked. The data collected can then be sorted, analysed, and used for predictive modelling purposes for risk reduction. This determines the overall health profile, risk profile of that group. Most owners and managers have a wealth of data on crew claims above the deductible. However, under the deductible, this data is lacking. The data that's needed ranges from simple demographic information such as age and gender to more detailed issues such as obesity and behavioural questions including smoking, drinking or risky pastimes. This data can be collected from the information contained on PEMIs, clinical information based on claims reports, and through self-reporting by crew members via health risk assessment reports. This data is a really powerful tool because it allows a ship owner to calculate their future healthcare risk and make the appropriate business and benefit decisions to put in place a targeted health support program. This detailed analysis of high-quality medical data allows the company to perform an early identification of at-risk populations who can be targeted with proactive programs to help those individuals who are at risk of certain health conditions. For instance, programs to combat obesity among a certain group, such as a certain nationality of seafarers, could help mitigate associated health problems, including heart disease and diabetes. You can see here a breakdown of medical incidents handled by Futurecare between January and September 2014. Total incidents managed were around 3,500 for the 20,000 seafarers on board between that period. 16.2% of this population were referred to Futurecare for various conditions. You can see the highest proportion here were injuries, followed by illnesses, followed by injuries and then dental. So our goal really is early identification of existing or emerging health risks, which allows us to proactively implement targeted programs that effectively address the condition. For example, certain common chronic conditions such as asthma or diabetes, for example, they're quite manageable using targeted, proven clinical approaches. So, proactive treatment has several benefits. By lowering the risk of a particular health conditions, the ship owner enhances productivity by reducing health-related absences. The crew members get the benefit of improved health, while ship owners enjoy lower healthcare costs. Futurecare services have been proven to result in less repatriations, increased fit-for-duty rates, and less unnecessary emergency port calls. This targeted use of intelligent data by Futurecare allows the company to put into place more effective strategies to manage employee health and to make healthcare more efficient. And really, who can argue with better health at a lower cost? Thank you.
Sophroni, your speech was very interesting. The main topic was about the telemedicine. How can Futurecare involve with that telemedicine?
Well, telemedicine really gives captains and first officers access to a doctor and medical advice at sea 24 hours a day, 7 days a week, 365 days a year. So if a crew member becomes injured or ill, then the captain can speak to our team of first responders and nurses and doctors and get medical advice. And this prevents the need for a medical evacuation. Quite often now, because diagnostic tools on board the ship have become so advanced, our remote doctors can really see via iPads or medical apps what is wrong with that crew member and can help manage his health care until he arrives at the next port of call, whereby then we can book him into the right hospital and manage his treatment. Telemedicine literally saves lives because you have crew members at sea, they don't have a doctor on board, the captain is only trained really in first aid. If someone gets ill, they need medical advice and they need someone to really see what is wrong with that crew member and the kind of doctor he needs to see. No, it really is very inexpensive actually. When you join our Caring for the Crew program, you just most of the correspondence is done by email, goes straight through to our first response team, who then asks some questions about the crew member, try and identify exactly what's wrong with him. And now that they have very easy computerized systems, which the doctor can see the patient, see the crew member face to face, and can quite accurately diagnose what is wrong with him. So it's not expensive to use that, but you give him a much better level of healthcare on board, and the ship owner saves money because he doesn't have to make all these unnecessary emergency evacuations. In 98% of the cases, an emergency evacuation is not needed.
So, more details about how important is this telemedicine, how it can help to save money or anything for the ship owner.
Yes. Well, not only with telemedicine, but now we are actually starting a very data-based approach where we analyse all the crew members' health data and building databases for the ship owner. And we look at their PEMI information, we look at their chronic conditions, we speak to them about their healthcare issues, and we put this all into a database so the ship owner can really start to see his crew members, what health issues they may have, and so that we can put in programs to proactively look after these crew members on board. So this proactive approach also very much helps to control health on board and to, improve the health care of our crew members.
And about Futurecare, how can support this generally the health of the crew members?
Yes, not only by providing assistance at sea, but also at portside. We have an international network of clinics and hospitals all over the world where we know they're good clinics and who we have worked with to negotiate better rates on behalf of the ship owner. The huge issue really with ship owners, they are being overcharged in port hospitals around the world. If they work with Futurecare, they will not be overcharged because we make sure that we only use facilities that are charge them the correct rate and normally also reduced rates because they're working with us, and this makes a huge difference. It can make a huge difference in the medical costs overall.